All right, good morning, everyone. Welcome to our May Utah Children's Care Coordination Network meeting. We're glad to have you all here today. It's hard to believe that this is our last meeting before summer is official. The year has zoomed by so far. All right, we'll get started with some announcements. We have a resource highlight today from the National Ability Center. And then our learning session for today is going to focus all on legislative items that affect children and youth with special health care needs that were a part of the 2026 Utah legislative session. And then we'll wrap up around 9:25 with questions. So just as some housekeeping stuff, if you um, are able to rename your profile with your agency and your role. That helps us, again, keep attendance for the meeting. We'd love to also have you introduce yourself in the chat if this is your first time to our meeting. We have an active listserv that we use between meetings, and I'd love to get you added to that. So if you can include your email, that would be great. So for announcements, I wanted to remind everyone that the updated summer resource guide has come out from Utah Parent Center. It's on their website. It's got a lot of really great ideas and resources and divided by county for the different options that are available per county. So that's a really great resource for parents and families. And ties into our resource highlight for today as well. We hope that will pair well with what National Ability Center is going to share as well. So we have just a couple of minutes. If anybody has a quick case that they want to share or have questions on, I'm just going to pause for a minute. You can raise your hand or unmute yourself and just start talking. If anybody has any announcements as well, other announcements or things to share. Okay, I'm going to take that as a no and move on. All right, so for our resource highlight today, like I said, we have Tracy here as the Chief Program and Education Officer from National Ability Center, and I'm going to turn it over to her.
Great. Good morning. Let me just get my PowerPoint up here for you. You see okay? Perfect. Great. Well, thank you so much for the opportunity to be here today and to share a little bit about the National Ability Center. I hope some of you have heard of us before, but if not, the plan will be that you know what the resources are throughout the state of Utah. As it was mentioned, I am the Chief Program and Education Officer and have been a part of the organization for 24 years. So I hope that I can answer any questions that you have and can be a great resource for you. Happy to answer questions along the way or at the end, whatever is best for you. So if I'm talking about something and you'd like to know more, please stop me and ask those questions. So first, the mission of the National Ability Center since 1985, when we were established, has been about empowering individuals with disabilities. And I think a big part of what we do, which I'm going to talk to you about, that people think about is the recreational component. But understanding that through recreation, sport, and life skills programming that we provide, our focus is about lifelong impact and building confidence and self-esteem and how coming here and doing these things can hopefully ripple into people's lives, which we have testimony and amazing stories from our families that have been a part of the program. Who we serve at the National Ability Center and understanding this group with children and youth, but I hope that you will talk about us after this call is please know that we do serve all ages and abilities. Age 3 is about the earliest for some of our programming and early intervention programming that we partner with. up to, since I've been here, the oldest that we have served is 102. Recreation is lifelong, and those benefits are helpful across the board. We run programming in a couple of different ways. And sometimes I hear people say, well, that's just, that's a lot of, how does that work? And I just say, well, there's something for everyone. So depending upon the individual and the needs that they have, maybe one-on-one programming is the best. Or in some cases, for let's say our equestrian program, we may have three people helping to serve one individual. So someone leading the horse and then two people sidewalking to support that individual based on their physical needs. So individual based programming to group programming so we can add it and incorporate social skills and peer mentoring and that sort of thing through our programming. We also have families. Inclusion is very important to us. And so having families being able to come and recreate together, or siblings specifically coming to camp together is something that we provide as well. We also have specific groups. So, for example, here in the state of Utah, there is a Rett Syndrome Association group, so rare disorder, and not a lot of girls in our area that have that, but we work together with them and run programming for them twice a year that they come together as a group. Provides a great opportunity for the parents to get together and provide resources and share and that sort of thing. And then we go and do programming with their daughters and then incorporate in the family into some of that programming. So lots of options for people to think about. A couple of key things that I want to make sure that you know about is we do have fees for our programs. Those fees are heavily reduced, but recreation can still be really expensive. And one of the barriers we know can be that financial barrier. And so, if you could please share with your families that we have a full scholarship program. And so that should not be a barrier to someone coming and trying recreational programming or finding a program that they want to be a part of for years and years to come. We're community based, so no one is kicked out. People can continue to come to the same programming or try our over 21 different programs. The scholarship does have an application, but it does not ask a lot of personal information. It does not ask how much money you make. So really what it talks about is what is the need of the scholarship? You can do that on a percentage basis. And would you be able to participate without the scholarship? So really simple form that families fill out when they go to register for our program. So in program subsidies and scholarships, last year alone, we gave out $6.7 million in subsidies and scholarships. And those are raised through our events and through grants. And one of the number one things I hear from families is like, I think someone probably needs it more and they don't want to apply. And I go, this is why we raise money. So please encourage your families if they need it to apply for scholarship. So here is a list of all of our overall programming. As you can see, there's quite a bit. A few things that I'd love to point out is one, we run programming in that session format is the verbiage that we use. So for individuals that live close to us, at our location, our main location is in Park City. I'm going to show you a photo of our locations in a few minutes. We also run programming in Moab. And then we are also open to traveling. So we've traveled up to Ogden and different areas, bringing our bikes and resources to school districts and working with special education departments on finding appropriate equipment so that everyone can be involved in recreation. So while our main headquarters are here in Park City, we are open to serving across the state of Utah. So looking at these programs, as you can see, there are lots of different options. Some key things as we're moving into summer and to connect over to the Utah Parent Center resource option is, thinking every child deserves to go to camp. And so we do have summer camp opportunities. Those are day camps and overnight camps. We do provide transportation from Salt Lake on a daily basis to come up to campus if that is supportive. We have not expanded transportation beyond that. But so if people can get here, then throughout the camp week, you have the opportunity to participate in a wide range of programming. Our camps team is run by a special education teacher. Where we provide positive behavior supports, transitional supports, and then have amazing adaptive equipment and trained staff to support a variety of populations. About 30% of who we serve fall within the intellectual disabilities and neurodiversity. Another 30% are actually those that served our country, so veteran-based population, and then pretty much everything in between. So disability, disease, and illness. We partner with groups from out of state. So about 40% of who we serve do come from out of state. Sharing that because we partner with a group from Texas that bring all children. It's called Cheyenne's Champions for Children, and they are children that are all rare and undiagnosed. And so we partner together to serve that population. We partner with Craig Hospital out of Colorado and are serving youth with spinal cord injuries and brain injuries. And then, as I mentioned, here locally, we are now partnering. I actually have the privilege to speak to the Salt Lake City School Board this afternoon about a program that we just started this year with the school district and serving their students who are all on IEPs. And so happy to get connected to whomever we can across the state to make sure that people have resources. Looking at this, we also know that there is that cliff that happens for our population with transitional skills. So after that age of 22. So please know that we do run life skills programming and social skills programming starting at age 16. And then we do run an internship for individuals with disabilities to work on job skills and that sort of thing coming to the National Ability Center. Any questions about these programs that are listed? I could talk about every one of them for a really long time. I guess one
Tracy,
other
we
that,
did,
yes.
oh, sorry, we did have a question pop up in the chat. Somebody asked about if swimming was provided, swimming
Hey,
lessons.
thank you so much. And if you're like, hey, something is missing on that list that NAC should be thinking about, please reach out and advocate and let me know. I love that you brought that up. We did run an aquatics program pre-COVID, then paused that program with COVID. And actually, I just presented to our board of directors, and we will be bringing aquatics back. And so, because of that water safety component and knowing, right, very high risk for a lot of our populations and concerns, and a really great transitional skill, as you can see, into water sports or paddle sports or rafting and Moab for a family to go on. So we are right now creating our curriculum again, building our partnerships with pools, and we'll be bringing that back. Great question. Looking at this too, a couple of key things. So some of these look really fun, but I want to make sure that you understand there's a lot of other great benefit in addition to fun. And so when I look at that, I look at our equestrian program and what an amazing program where we can work on core strength, fine motor skills, hand-eye coordination. The movement of the horse is the same movement as our walking gait. And so there's a lot of great skill development, muscle relaxation, just so many things that can happen within that program. And, and kiddos are having a great time being with a horse, right? And engaging and building that relationship there. So that's one of the things we heard from the school district. We worked on an indoor climbing program with them, and they are showing increased fine motor skills and students increasing their ability to hold their pencils in class and how they're writing in class. So great benefits that can come along with that. Wanted to let you know that we're on track to serve over 7,000 people just this year through our programs. And then as you can see, experiences, so that's coming to an equestrian lesson one time. So you can see that individuals are coming for multiple experiences, which is really great on our end. So again, we can build that relationship and work on those goals and objectives and help them to maybe try something that they didn't think was possible. I can't talk about the NEC without talking about our volunteers in a great way. One way that we're actually working with the University of Utah and their resident program is having their residents come up and do some volunteering and learning about the impacts of adaptive sports. Without our volunteers, we can't do what we do. So that example I gave you of equestrian, where I'm teaching a student, a person that's on the other side of the horse and then the person that's leading the horse are both volunteers. And that's what allows us to keep the cost down. It also allows us to decrease stereotypes and increase awareness about inclusion for our community that's volunteering and understanding more about disability. So our people, important to know that we are not medical professionals and that sort of thing. We are recreation specialists. We do have therapeutic rec specialists, special education teachers, some OTs, but a variety of staff that go through industry standards and internal trainings and certifications to to run all of our different programs, run population specific trainings and that sort of thing, and then follow through with checkoff systems and training systems for each. We do run programs that are high risk, right? Whitewater rafting and a high ropes course, as you see here, and can have some precautions, certainly for the different populations that we serve. And we run detailed training for each of those programs. Letting you know we have multiple locations if you haven't been here. The photo on the top left is our ranch location where we're on 26 acres, surrounded by a full trail system that is operated by Mountain Trails program where we do hiking and intro to mountain biking. On the top right, that's our hub. It's a recreation center that we have on our campus. We run special events in there from a youth perspective. We found that there was a need for an inclusive Halloween event where maybe someone's aged out or they're scared of certain aspects of Halloween. So every year we run a free community event. Our entire campus turns into a beautiful theme. Last year we had over 300 people come to this event. Just a few weeks ago, we hosted a prom, 16 and up, for individuals with disabilities. So this space is just awesome. We run pickleball in there, yoga, you name it, and obviously indoor climbing, as you can see that wall on the back. The bottom left is in partnership up Weber Canyon called Camp Oakley, fully accessible yurts, fully stocked fishing pond, heated sidewalks. We run year-round adventure trips out there for families and individuals. Maybe you're not quite ready to go and figure out how to stay in a tent, which will help you with that too. So this is a really nice transition for families and individuals to try. And then bottom right, you can see this is our Moab operation where we run 7 different river sections. And so a wide variety of options for people to go, but what an amazing way to connect as a family to go on a river. That can be a day trip or a multi-overnight trip, but to kind of separate from all the things that are in our life and get on the river together. A lot of times something that families didn't think they could do. 3 years ago, we built the McGrath Mountain Center. It's our ski and snowboard program, our largest program. We run 5,000 lessons out of this. Oh, was that a question?
I don't think it
No?
was a question. I think
Okay.
somebody just accidentally unmuted themselves.
All good. No worries. Showing you this so you can see that wide range of equipment that's up on the wall. So, a question I get often from families is we used to be a skiing family or a snowboarding family, and now our loved one was diagnosed with this or born, with this. Do you think that we'll ever be able to ski again? And I love to say yes. It may look a little bit different. It may take a little bit of time, right, from an assessment and finding that right equipment. But through our amazing people, our people are our special sauce at the NAC, and then adaptive equipment and the innovation that has come along with adaptive equipment, we really can provide almost everyone with the opportunity to slide on snow or to do all of those other programs. Please know there are a few rules, right, and policies and safety regulations. Some programs do have a weight limit. There are contraindications for certain populations for certain programs. And so those are things in general, for the most part, we're able to get maybe a higher level spinal cord injury. There would be certain programs that are more appropriate, that sort of thing. All things that we can discuss with you or with a family member or that individual to explain and to pick the appropriate program. I wanted to show you partnerships. We can't do what we do without partnerships and inclusion, as I mentioned. So we run our water sports program at the Jordanelle State Park, so everyone can see, us water skiing and paddleboarding, and when we're on the mountain, people recreating together is what we want. And so we're thankful for our beautiful campus and our facilities, but really thankful for the community inclusion, again, to help break down those barriers. A couple of pieces of cool equipment on here just to show you. One of the other things that we see is when families are ready and they're starting to find like what is the right bike for my child or that sort of thing. Sometimes we see that they actually purchase something that isn't the right fit for them because maybe another family that they met said like, oh, we got this bike and it's been great. We have over 300 bikes in our bike barn here. So being able to coordinate, which we have done with other medical professionals, to come up and do an equipment assessment and figure out what is going to be the right bike based on their goals and based on their abilities. And we want to see people getting that because a lot of times people get turned away because they're not in the right equipment. And so knowing that we have this full fleet for families to utilize as well. Couple other photos here so you can see adaptations and different ways that we can get out and recreate. We do also, in some cases, depending on the equipment, allow for a rental once we have seen that they have the skill set to be able to utilize that on their own. I mean, what shows more success than being able to help to build skill and build family support and then being able to go out and recreate on your own? You can certainly always recreate with us. Again, you're never kicked out, but an awesome opportunity if we've been able to implement the skills that a family needs or an individual needs to be able to go out with their family. We've talked a little bit about benefits and goals, but please know that we can custom build a program for a group or an individual that can focus on social, emotional, physical, a wide variety of goals to be able to meet individual needs. A really awesome kind of continuum of care is what I like to look at it as. You're not coming to, this therapy session. You're coming here to recreate and play and build skill development, and then we can incorporate those other components. So we see a really high involvement and engagement and a change of mindset even from one day to another. We do require pre-registration. There is a waiver that is required to be completed for anyone that is going to be involved in our programming. And then there is something we call it the participant information form. So a document that is completed online. It does ask pretty detailed information about diagnosis, medications, seizures, allergies, surgeries, wide variety of information that allows us to pre-review that information, make sure we have the right equipment, the right staffing, all of those things ready to be the most successful that we can be. We then do document our programming. So after every lesson, there's something called a progress note that is completed by our staff. Through that, we document the equipment setup, key teaching styles, goals and objectives that are being worked on so that we can make sure that we pick up where someone left, whether that was the week prior or the summer prior when they were here or the winter, so that we can continue to build on those skills. A couple of quotes here, I think just important. I truly believe like recreation isn't like, oh, it's a nice or maybe it should be there. I truly believe that recreation should be a part of everyone's life. And it's not something special. It's a right. And the benefits that come from that are just amazing. We've seen people take their first steps here. We have seen families reconnect and find a bond through recreation. Oh, we're missing a little word there. And so, what I love to know is how we can best serve the people that you're serving, how we can best connect to them and make sure they know that this resource is there. We've been around since 1985. When I go to Salt Lake or go across Utah, people say, I haven't heard of the National Ability Center. And that breaks my heart. So how we can step it up to serve our full state and community is what we want to do. So I'll end there and answer any questions. The only thing I'd ask is to share, advocate, and collaborate. So referrals or events that you feel we should be at. We were just at Trauma Survivors Day at the U and other places where we can connect with families and help to meet their needs. And I just ask that you talk about us to make sure that people know that we're here.
Thank you so much, Tracy. We do have a couple minutes for questions. I see one came up in the chat about if you have printable flyers for families that they could help distribute in both English and Spanish.
Yes, we do. Athena, would I send those to you?
Yeah, that'd be great.
Okay, great. Yeah, happy to send those out. And then similar, listening to what you talked about this morning, it sounds like you have this great resource group. If it's something that I can send over, like I talked about that prom that happens once a year, or these other events that we could help to make sure that we get out, I'd love to add that to our marketing team to share those resources over. Similar, we have a free open house Saturday, May 30th for families to come up and check out the campus and meet our camps team. And because we know, right, that can be really, really nerve-wracking and have a lot of anxiety around going to a new place or what does it look like. So I can send over a flyer about that day too.
That would be great. Yes, we'd love to have any information. We have about 150 people on our mailing list, so if you can send
Okay,
anything to me and I can distribute it to our group. What
great.
other questions do y'all have for Tracy?
Tracy, this is Heather Carlson. Hi, thanks for
Hey,
the
Heather.
presentation. I just picked up a new client with Rett syndrome, little 3-year-old. So you were talking at the beginning about the inclusion of just a specific group for Rett syndrome twice a year.
Yeah.
Are so is that what they do? Is just for the year they do those two activities together, but they can also do other activities?
100%. Yes.
Okay,
And Heather, my email was on there, but happy, Athena, for you to share that out too, maybe when I send it. I'm also happy. A young lady that I teach in the equestrian program has Rett syndrome, and her mom helps to oversee this support group. And so would love to make sure that they're connected. So yes, as a resource, they get together more often as a
okay,
family resource, as a resource group for the families. But the NAC hosts these two kind of seasonal based events for them to come to our campus. But then this young lady that I talked about, I teach her every Thursday at the equestrian program. So families are coming on a weekly basis as well.
awesome. Thank you so much for clarifying. Thank you.
Yeah.
We had another sorry question in the chat too about if services are offered for non-English speakers or interpretation services included.
Thank you so much for that question. We do have our documents that can be completed in Spanish. And then, yes, we have a Park City Community Center has a partnership with us to be able to support some of our staff are bilingual and can support something that, again, needs to be requested when they do that registration process. So, again, we have the right staff here, as well as right following with sign language interpreters and all of those same things. Yeah.
Naomi, you have your hand up?
Yeah, thank you. Um, how do you help support families who are unsure how to like do recreation? Do you explore different pathways they can take?
Definitely. Thank you for that question. So, a lot of times families, at least in general, will feel comfortable maybe helping to come up and register their child who has a disability, disease, or illness, right? So they'll come up and watch on that. And to be honest, one of the best ways to do is for us to get on a phone call with them and talk, and find out a little bit more about what their goals are, what's their family dynamic, what are they interested in, what are they nervous about, and so then we can help to point them in the right direction. Hey, we think this would be the right thing to try first, or let's schedule this. And so, a little bit of a phone call assessment is usually really helpful, or even coming up if they're able to come up for a tour and just kind of, show those different programs. So, based on what their goals are, we would then help point them in the right direction.
Amazing. Thank you.
Hmm.
Natalie?
Apologize if you already answered this because I had to take a phone call, so I missed
No
a little bit.
problem.
But I heard you say that you have volunteers from residents, but are there other ways that people can volunteer or become qualified to volunteer with your group?
Yes. Yes, thank you for that. And I didn't really answer that. I just said we need volunteers, right? So we utilize volunteers in every single program that you saw in there, our special events, to anything. So we do online on our website is a place that people can sign up to be a volunteer. And then based on a program, I'll stick with program since I'm the program person, that you're interested in, it will list off if there's any prereqs, but say you're like, I've never done equestrian, but I'd love to volunteer. You would sign up for that. You would attend a training. Every program requires a training for you to attend. And then there's a check off within that. So again, if you want to help at climbing, you have to check off in our belay systems, just like our staff do. So you attend that training, and then you, as a volunteer, the great thing is that you get to choose your schedule. So then you go on and see the openings that are needed, and then you would sign up yourself based on your availability to be able to come up and support. You can also work with a team. We have certain people who like really want to support with certain populations, or they want to support with certain programming. And so you can sign up that way too.
Great. Lots of ways to get involved.
Yes, definitely.
Perfect. Does anybody else have any other questions for Tracy? I will make sure that her slides and flyers get posted to our Trello board, and then send out her contact information as well with the group.
Please do. Please reach out. Available. We want to make sure that we're connecting and providing life-changing programs. That's truly what I feel like we do. So thank you so much for this opportunity. Thank you for all that you do for our families and youth and kids across the state.
Thanks, Tracy.
Have a great day.
All right, we're going to turn the time over to Gina now for our annual legislative update. And Gina is our guru in this area and has been forever. So we're excited to hear from her today.
Anyway, hello all, and definitely hello to, this feels like coming back home with all the friends that I've made since the beginning of my career. In a hurry, and unfortunately this, okay. Okay, so mine's not going to be nearly as exciting as Tracy's was. It's so exciting. And part of what she has done over the years for many friends and family of mine is the quality of life issues too that they get to experience. Things, I mean, one of her pictures was a colleague's son that has since passed away, and just the equestrian piece and the adaptive skiing and such. That young man did more than I will ever be able to do in a lifetime, and a lot of it was due to the National Ability Center. So I'm charged with doing the overview of this last legislative session, and I'm going to give you information of children and youth with special healthcare needs, disabilities, and children in general of what had happened. And just as a reminder for our legislative session, since every single state is so different, we have a 40-day session that starts about the second, third week, depending on how the month falls in January, and then goes through about the first week of March. We are the shortest in the nation. This last legislative session, there's over 500 bills that were passed, which we were all kind of amazed at. Some great, some not so good, but they were passed. The session was way better than the majority anticipated. And so going into this, as I say, some of the things, and you're going to think, well, that's not much. Part of it was we heard even before the legislative session that all the leadership were told no new funding, no new bills, and we are going to do cuts this year due to a lot of different issues. But so we were really nervous as lived experience advocates going into this, thinking, this is going to be so bad. This is going to devastate a lot of the programs and services that our families and individuals with disabilities just need and deserve. So, one thing that really did happen, and we seen it firsthand, was I'm with the Legislative Coalition as a volunteer and have been for years and years and years. And since about 1990-ish, the Legislative Coalition for People with Disabilities has done a reception for legislators to meet with their constituents with disabilities every single year in January. And in this last couple of years, it's had to be the first week in February. But that way, the floor is totally up to the families and individuals with disabilities to talk about the day in their lives and how much services mean to them for quality of life, for even some of those things, the medical issues, the healthcare insurance issues. So we were going in knowing that people were talking about, and it was on the list, cuts to disability services. And the biggest part of it was cuts to DSPD, which we all know there's a huge waiting list there, and it gets bigger every year. And so this year was our second year. We teamed up with the Utah Parent Center, the DD Council, Utah State's IDRIP program, the independent living centers across the state, and on to have a disability advocacy day. And because of the threat of these big cuts and, thoughts of what their livelihood would be without the services that they so need, we had people show up in groves, and it was beautifully orchestrated by the parent center as well as the other partners, and it was a full day of um, advocacy, and they had a rally with their self-advocates, and then it ended with our reception at the end of the night with, we don't always get a whole lot of legislators to come. Most of the time they'll come if one of their constituents invites them, and sometimes they won't because they do know that the cuts are on the line. But because of those with lived experience and inviting them and coming to that full day, the cuts to those disability services on DSPD were taken off the list. And that was huge for all of us. And the other thing that was happening was, and this is my own opinion, so I'm not speaking on behalf of anybody else, but the Disability Law Center this last year was really under fire. There was an intent to redesignate our protection and advocacy organization in the state, which is the DLC, or better known as the Disability Law Center. That did not pass, and that took a lot of advocacy and such on part of families and individuals. So to start out, the bills that affect all children, and this, still gets into those children with special healthcare needs and disabilities, and I'm going to give a really, really brief overview of each of these and kind of why it matters. And then towards the end, I'll give you a resource to, if you want more information, or my personal email, because I'm happy to walk you through it or give you as much information as needed. So the first one is House Bill 108, and this is the minors in state custody amendments. And this is, it will create an account that deposits funds into the minor beneficiary accounts for children in DCFS to use once they age out of services. For children with disabilities, these funds will go into an ABLE account. And what's so important about this is I didn't realize until I had worked on a project, and even Medicaid and such is really affected for those children that are in DCFS custody. So the fact that this one, there's a lot to it, but the Department of Health and Human Services will look at helping to get like Social Security income or Social Security disability insurance if they qualify for that through their parents. Get that set up and applied for. So when these adolescents that are transitioning into adulthood, they're not left with nothing, that they go out and have a little bit better chance once they are exited from that. And then House Bill 174, the sex characteristic change treatment amendments. We've seen this all over the news, knew there was going to be changes and such, but this bill will amend existing law to restrict the provision of hormonal transgender treatments to minors. There are some steps to it. There is even a grandfathering, but pretty much all they will not be able to prescribe some of those hormones and such after January 28th of 2027. So that is one to know, because they really put a lot on what healthcare providers can and cannot do. and House Bill 559, which I was glad to see this one. It's one of those that it's hard for these women and families that have gone through this, but it's a pregnancy and infant loss amendment, and it will establish new requirements for healthcare facilities that provide birthing services and for the healthcare providers to better support individuals experiencing pregnancy or infant loss. Um, just a quick, my sister had a pregnancy loss she was 40 weeks, and at the hospital, they moved her immediately into kind of what I describe as the very back dark part of the hospital. And I asked, why she was moved right after this. And we were told that it was because they didn't want to accept or upset the other new moms. And it's like, but this mom just lost her. So I'm really happy to see something like this, that it's actually going to offer training to healthcare providers and such on, helping those families through that horrific experience. And Senate Bill 167 is the reintegration for disciplined students. And this is really, it impacts those disciplined students, but it adds to that language those who have any school safety incidents or safe school violations to the list of reasons a local school board may deny a student's application. It will also set timelines for when reintegration plans must be made if a student's reintegration date is provided during the summer. So in some cases, it hurts some students because, the board can say, especially if they're out of the district lines and such, they may deny that application. But the good part of that is that there needs to be a plan in place. And then as I'm going, let me look real quick. Senate Bill 170, the vitamin K amendments. This one wasn't surprising, but it establishes a new requirement for healthcare providers regarding the vitamin K administration to newborns. It will mandate, though, that these providers fully explain the risks and benefits of vitamin K and the potential adverse health outcomes for newborns who do not receive it. And this bill put it in, like others, that the bill will grant parents the right to refuse those vitamin K administrations for their child. So the next one is Senate Bill School Discipline Amendments. We will be implementing requirements for the use of seclusion rooms in schools. And this one's actually a huge win because it will include audio and video recordings, venting, heating, and cooling requirements, and much more. We've seen just bad things on the news, but these things are happening with the seclusion rooms and such. So the fact that they are looking at some of this makes us all feel tons better. And then the Senate Bill 222 this one is also one that I am glad to see that they're moving along. And this really helps a lot of our undiagnosed rare disease community, as well as others, where expands the definition of an eligible illness. So that's great because it kind of put in a box. And it will include those that pose a substantial, severely debilitating, or life-threatening risk to a patient, and for which conventional therapy options are unsatisfactory or comparable. So with their treatment, and this has a lot to it too. You have to go through, the FDA and the research studies and such on investigational things, but it's a step in the right direction. So these definitely affect children, youth, and adults with disabilities, but I kind of put them in different things where they kind of cross all three. But on House Bill 12, which, Tracy was on talking about recreation, but this one is outdoor recreation accessibility amendments. And This will add to what's already in there, that construction of trails or facilities or improvement to trails or facilities or the acquisition of equipment for disabled or adaptive users, that they will all go into recreational infrastructure projects going forward so that there can be some more inclusive outdoor recreation. And House Bill 15, this is a little bit of a longer one, but it is the Medicaid amendments. And this bill amends provisions related to Medicaid expansion in Utah. And it's primarily adjusting the eligibility criteria and program administration. But it does increase the income eligibility ceiling, which is good and bad, but for Medicaid expansion to 133% of the federal poverty level. This really aligns with those federal programs. And so when families or individuals are looking at, their eligibility, there's always the eligibility on the federal side, and then there's the eligibility on the state side. And since we know that the Medicaid and our state Medicaid and federal, it's a partnership on providing these things, some of the alignment will only make it better. This bill also allows greater flexibility in how the state obtains federal funding, specifically by seeking to maximize the FMAP, which is the federal Medicaid assistance percentage, which is how much the federal government pays towards our Medicaid services. So that will be great that they can maximize that. And then it also introduces cost management provisions, including the possibility, this is not the good part, of closing enrollment if funding is insufficient, and outlining potential cost containment measures if the federal matching rate for expansion drops below 90%. This is really not good, and I'll talk a little bit right before the end about Medicaid. The bill also clarifies how counties contribute to Medicaid costs and modifies reporting requirements for hospitals and the state regarding Medicaid expenditures and program performance. So it puts a lot more on DHHS. So House Bill 23, the service animal amendments, I like this one in the beginning because part of it, this part did not pass, but it would have increased the penalty for the abuse of these animals or harassments of the service animals from a Class B misdemeanor to a third-degree felony. But unfortunately, again, that did not pass. But what did pass is it will require the Division of Corporation and Commercial Code to provide the contact information website for DLC, the State's Protection and Advocacy Agency, on all their public websites, so that if individuals are having a problem with people not allowing them in because of their service animal, or if they can see that there is abuse going on of that service animal. The next one, House Bill 71, the Health Provider Directory and Access Amendments. This bill aims to access to behavioral health services and the accuracy of provider directories. Starting January 1st of next year, insurance companies must establish procedures to help individuals find out-of-network mental health providers in a timely manner when no in-network provider is available. And they must enter into a single case agreement with these out-of-network providers to cover services. Again, this is good because we know that the access to some mental health services has been hard, given kind of our single provider or payer system the way it is. So this gives a little bit more free agency to make sure that those individuals can access services that may be more helpful to them. And House Bill 143, the special education amendments. So as you can see, there's a lot of amendments. A lot of these came with funding issues as well. But if a local education agency, otherwise known as a LEA, and that's their school district, if their boundaries change and it affects the location of the special education services or classes it requires that school district to notify the parents at least 30 days in advance of the change. Why this is important is because placement usually is, at the discretion of that school district and school to find the best placement. And sometimes, that has happened fairly quick and with not enough notice for families to make adjustments and take their child out of where they may be comfortable and thriving. So that even though there's still that option that they can place them somewhere else, at least there's some notice. House Bill 270, the Healthcare Workers Post-Employment Amendments. Again, this really helps a lot of those families or individuals with undiagnosed or rare diseases when they find a specialist that may be helping them through some of these things, and that specialist moves. There has been those non-compete agreements that most healthcare workers have had to sign. And this, and it's between the employer and that worker, but this will make it void. So that will help with some of the access to if one of these healthcare workers changes employment. So House Bill 393, Early Intervention for Dyslexia Amendments, which creates the dyslexia screening pilot program and develops a statewide dyslexia intervention plan. So that's also really good. Senate Bill 54, the Carson Smith Opportunity Scholarship Program amendments. This one, for those of us that, know and love the Carson Smith scholarship, has been hard for a lot of us to see how it's morphing because they try to merge it with the Utah Fits All Scholarship program that passed a few years ago, giving families of all children access to scholarships. So it kind of didn't do justice for what the Carson Smith opportunity or scholarship was made for, but it made several changes to the Carson Smith, including eliminating, this part is good, the income requirement, but it removed eligibility for sibling and aligning requirements with the Utah Fits All Scholarship Program, which is not so good. But it does also make parents of those scholarship recipients ineligible to serve as that home-based school provider. So they would not directly get that scholarship back to them, which that's good because we were all thinking, okay, we were hoping it was for those specialized schools, private schools and such. So that actually, there's good and bad in that bill, that according to at least those advocates that were really supportive of the Carson Smith. This will help, of course, it can help children, but there's a lot of the adult programs. So House Bill 53, Community Rehabilitation Program Amendments. This bill will extend the sunset date and implement reporting requirements for a program that supports government agencies with position vacancies by contracting with treatment. Sorry, I went to the wrong one. Contracting with community rehab providers to help fill these roles with adults with disabilities seeking employment. So that actually is really good. Senate Bill 154, there were still some things that they put on the Disability Law Center. And this one is not so bad because they already do this. It requests additional reporting and engagement requirements for the Disability Law Center, including legislative reports and meetings with the public. The DLC, as I stated, already does all of this because they provide a federal report open to the public and host community listening sessions throughout Utah. So that one, even though it passed, it's not a big deal because they said, they're more than happy to share whatever reporting and information that the legislature would like. And Senate Bill 158, Recreational Therapy Program Amendments. This is awesome. This bill amends existing Utah law to expand Medicaid reimbursement for recreational therapy services defined as therapeutic interventions provided by qualified professionals to improve a person's physical, cognitive, emotional, social, and leisure functioning. Specifically, it updates the definition of a behavioral health program and adds residential support program as a new category or facility eligible for these services. So hopefully that opens up some more opportunities to our family members. So Senate Bill 160 is Medicaid reimbursement amendment, rate amendments, and this makes permanent the budgeting mechanism that allows Medicaid reimbursement rates or applied behavioral analysis to increase. So that's also really good because we know that ABA and such is such a great resource for a lot of families. And Senate Bill 161, this is another issue that's kind of been contentious between even disability groups in the last couple of years, and they're both sides are right. Neither side is wrong. It's just a matter of where you're coming from. So this one, it will require healthcare providers not to base their assessments solely on or predominantly on the opinions of the individual seeking guardianship over another individual in guardianship cases. So that's good because we've had some, stories of where an individual really doesn't need full guardianship. They are perfectly capable of making their own decisions and may need a limited guardianship or supported decision making. Senate Bill 175 is the health insurance revisions. And this bill amends existing Utah law to expand and clarify health insurance coverage for autism spectrum disorder. So that's also really good. It also ensures that the health benefit plan covers the diagnosis and treatment of the autism spectrum disorder for children and adults. It removes coverage limits on behavioral health treatment for plans renewed after January 1st, 2020, and mandates that plans include qualified behavioral analysts and mental health therapists in their provider networks. Again, that's really good. Another surprising one given the year that we thought we were going into. Senate Bill 288, Medicaid provider. Oh, I know we're running out of time. So this one will give a permanent or some 2% rate increases to DSP to PD providers. And medical translation amendments, those ones are actually with the Safe Utah app, making it so that it's in other languages. Just real quick, early intervention received $2 million ongoing funding. We were hoping for 4.5 million ongoing, but heck, at least we got the 2 million. And then DSPD waitlist. This is where you have to remember that I said we thought we were facing cuts. 100 to come off the wait list into services is at least half full, I guess, because we're getting closer and closer to almost 7,000 on the waiting list. These ones I will not go into because you can look them up later, and I'm sorry that I rushed through this. And these are all resources that you can look at. A lot of us have we have a tracker for the bills that are specifically disability and health related. So those are some things you can follow even now because we will be going in, or we are in an interim session. And this one, that le.utah.gov, is a resource. It's made it very easy to navigate our state legislative website, and you can put in any of these bills if you want more information on them, and you can get to them fairly easily. And I suggest even setting up an account because you can put in categories of things you would like to follow or bills, and you'll get them sent directly to your email. If there's any questions, you can put them in the chat, and I'm sure happy to answer them afterwards. And here is my private email because I do policy for the Utah Regional Leadership Education in Neurodevelopmental Disabilities, and am happy to help find more information, let you know about the upcoming legislative session, or just answer questions in general. More than happy to do that at any time. Thank you.
Thanks, Gina. Lots of good information in there. So I've got Gina's slides up on our Trello board already as well, if anybody wants to go back and look at some of those specific bills. We are at time, but does anybody have any quick questions for Gina? We can stand another minute or two.
And again, if those questions come later and you just want to say, how is this going to affect the families and all of that? If I don't know, I know people that are way smarter than me that I can get the answers from.
Great. Perfect. All right. Well, our next meeting is going to be on June 17th, and we're going to have some more information about the Medicaid mental health carve-out specifically, and how that works with some of the other mental health programs. So should be a really good meeting, and we will plan to see you all then. Thanks, everyone. Have a good Wednesday.
Thank you.